Salutations everyone, and thank you for watching Diabetic Radio. This is episode 61, and for today's episode is going to actually be about a little mini documentary. This documentary is called Living with Diabetes, and it was done in Great Britain around 1956, 1959, somewhere around there. And it is the only video that I personally have seen, and I've looked at a lot of videos that really explains, or I should say, not only explain, but shows what it's really like living with diabetes on a personal level. It's the best video that I have seen thus far. And the person that's narrating this video, I'm not sure if he's a doctor or not, but he talked about one of the important things that I've just mentioned in my last video, and that is balance. It is so important to have balance in your life when you're a diabetic. Now, there are just one or two things in this video that are obviously outdated, but the basic principles of diabetes still apply today. Now, I should warn you that there's a part in the video where they actually perform injecting insulin. So if you're really squeamish with needles, I should forewarn you, just turn your head. But it is real life for us. Okay. There's some comments that I have about the video that I will save till after the video is finished. So stay tuned, and once the video is finished, I'll give you my comments. Enjoy.
For every 200 people in Great Britain, 3 have diabetes. That is about 6 people in every crowded train, perhaps half a dozen in this street. But these, the well-balanced diabetics, go unnoticed in the crowd. They no longer suffer from diabetes. They have learned to manage the condition, and they live usefully and normally with other people. What is the secret of their success? Well, perhaps this is best summed up by the motto of the British Diabetic Association: balance is life. But to understand this better, we must first learn a little more about diabetes and its treatment. Now, 2 things are of prime importance to the diabetic: his diet and his pancreas. The pancreas is a gland connected with our digestive system, and among others produces insulin. Our diet contains various substances which, when they are digested, produce sugars. Both the insulin and the sugar find their way into our blood, and here they provide the energy we need for living. It's important that there is just the right amount of insulin to balance the sugars. But if, for any reason, our pancreas does not produce enough insulin, or perhaps even produces no insulin at all, then the balance is lost. The excess sugar cannot be used by our bodies, so it accumulates in the blood, and some is lost through the kidneys. Diabetes, then, means that our body cannot supply enough insulin for our requirements. What are we going to do about it? Well, that may depend to some extent upon what sort of person we are. Let's take 2 diabetics, for example, one fat, one thin. Now, if we make this fat one lose weight, then his body will require less insulin to keep it going, and we may then find that his pancreas can keep pace with his requirements and his symptoms will disappear. The thin one, however, cannot afford to lose weight, and she will have to take extra insulin by injection. This is why about half the diabetics in this country take insulin, while others can be controlled by diet alone. But whether you take insulin or not, you must still preserve the balance between insulin and sugar. And this means controlling the food you eat each day. But this is the province of the dietitian, so let her tell you about it herself.
We all know that foods like these contain sugar, but although it is not quite so obvious, we can also obtain sugar from foods like these. They may not taste sweet, but as soon as we eat them, our bodies convert them into sugar. For convenience, we'll call all these foods, whether they taste sweet or not, carbohydrates. And in diabetes, it is carbohydrates with which we are mainly concerned. Individual diets must be based upon individual needs. Now, we need carbohydrates to replace some of the energy we expend each day. Obviously, a manual worker will have different requirements from someone who works in an office, but diet must also meet other needs. Now, you, Miss Smith, do for a living?
Oh, I work in an office.
And you don't lead a very active life?
No, not particularly. But I do like going dancing and swimming.
And you, Mr. Anderson, do you get much exercise?
I know what you're driving at. But after a hard day in the city, a spot of gardening is about as much as I can cope with. It's these business lunches. My wife says I ought to cut them down, but they are rarely necessary, you know.
That may be so, but when you go out to lunch, it's important that you know which foods you may eat. Our main concern at first will be to reduce your weight to what it ought to be for your height and age. You won't find that a great trial, and I'm sure you'll feel much better for it.
It's all jolly fine you talking about diet, but you don't have to do it. Look at this. Steamed fish and eggs. No sugar. No pastry.
Just a moment. There are quite a lot of things you can have without restriction.
Yes, I can see them here. Soda water and vinegar.
Now, look, I know this is going to alter your habits, but it won't be the end of the world for you, and you must do it for your own sake.
I suppose you're right. What about our thin friend here? Is she going to be put on a slimming diet too? Where's she going to lose it from?
Don't worry, you won't have to reduce. You're already at your correct weight, if not slightly below. But you will have to keep to a controlled diet in order to balance the carbohydrate intake with the amount of insulin that's been prescribed for you.
Well, dieting doesn't worry me, but do I really have to take insulin? Mr. Anderson was telling me he's having some pills for his diabetes.
I'm afraid tablets won't help you. You see, Mr. Anderson has diabetes mainly because he's overweight. But you have it simply because your body cannot produce enough insulin for your needs. People who are overweight, like Mr. Anderson, however, can sometimes be helped by tablets in addition to their diet. Now, in your case, insulin is essential, but you must stick to your diet, too. Because you're having a prescribed amount of insulin each day, you must balance this with the right amount of carbohydrate. Now, to make this easier for you to follow, we've planned your diet sheets to look like this. At the top, it shows the carbohydrate content of each day's meal, and also your daily allowance of milk. In the left-hand column, there are suggestions for each meal. These foods contain no carbohydrates, so you may have normal amounts of them without worrying about their effect on your diet. But you should not have them in excess, or you may become overweight. The right-hand column, you will see, refers to ounces of bread. This is the most important part of your diet because it represents the amount of carbohydrates. You must have exactly the amount shown, and you must have it at the appropriate meal. It's no good just making sure at the end of the day that you've had the right amount. This is particularly important if you're taking insulin. You don't, of course, have to have the carbohydrate as bread. This is simply a convenient measure. For each ounce of bread shown on your diet sheet, you may substitute some other food of a similar carbohydrate content. Now, here is a list of these equivalents to help you to work out your meals to suit yourselves. We'll begin with you, Miss Smith. Your daily allowance of milk is 1 pint. This includes milk for cooking as well as in tea or coffee. For breakfast, you're allowed 3 ounces of bread. That is, 3 slices from a cut loaf. But you may, if you wish, substitute this for some other food. For instance, you could substitute 1 ounce of bread for some cornflakes. A list of equivalents will show you the quantity. The other foods, eggs, bacon, and tomatoes, are allowed without restriction. You may, of course, have tea or coffee, but the milk must come from your daily allowance. You could begin your lunch with clear soup. The potato has been substituted for 1 ounce of bread. You may have a milk pudding, which will equal a further 1 ounce, and the milk must also be deducted from your allowance. Finally, you may have cheese and biscuits, the biscuits completing your 3-ounce allowance of bread for this meal. For tea, you could have a salad. Here we've made no substitution. The 2 ounce of bread is your allowance. You could, if you wish, use the bread to make a sandwich to take to work with you. Remember, the milk in your office tea must be deducted from your allowance. For dinner, you could have this sort of menu. The potatoes are equal to 1 ounce of bread, and the fruit to a further 1 ounce. You may, of course, have coffee. The biscuits are equal to 1 ounce of bread, making a total of 3 ounces for dinner. You must finish the pint of milk, so any remaining can be used for a final drink before you go to bed. Your diet, Mr. Anderson, is a little less generous, but only until you're down to normal weight. Then the doctor will prescribe a more liberal diet to keep you at that weight. You are allowed only half a pint of milk each day. You might have the sort of breakfast you see here. Your allowance of bread at this meal is 1 ounce. For lunch, you could have clear soup, followed by steamed fish and vegetables. All these are allowed without restrictions, and you may, of course, have coffee. If you have it black, it will conserve your allowance of milk. You could have a salad like this for tea. Once again, you're allowed 1 ounce of bread. For your dinner, you're allowed 2 ounces of bread. 1 ounce of bread is shown here. The meat, turnip, peas, and cauliflower are allowed without restriction. You may have a peach and tea or coffee, but if you finish your allowance of milk, you'll have to have it black. Finally, there are a few things which you must not eat at all. These are shown on your diet sheet, and they include sweets, sugar, food containing sugar, sweet drinks, and so on. For sugar, you may substitute sacchin. It is also available in liquid form, which you'll find useful in cooking. Well, now, does that make you feel a little easier about your diet?
At least you make it sound more attractive than it looks here. I suppose one can get used to anything in time.
Yes, and if you stick to your diet and reduce your weight, you should soon be able to go on to a more liberal diet. What about you, Miss Smith?
Well, I don't think I'll find it too difficult. After all, it's not much different from a slimming diet. But what I'm most worried about are these insulin injections.
Well, don't worry about it. Look, as you leave here, drop in and see the doctor. You'll find him most helpful about anything you want to know.
Thank you so much. It'll be most kind.
Well, we've dealt briefly with diet. Now, what about the diabetic who has to take insulin as well? You, for example, Miss Smith. No, don't tell me. I know. Apart from other things, you don't like the idea of having to inject yourself with insulin each day. Now, tell me, you clean your teeth every day, don't you? And polish your shoes? Mm-hmm. Well, really, making an injection is just as simple as that.
I suppose when you put it like that, it does seem rather silly, but, well, it makes life so complicated. Keeping the syringe sterilized and everything.
Now, look, the thing to do is to work out a routine and stick to it. Then, after a while, the routine will become purely automatic, and you won't have to worry about it anymore. But I can give you 1 or 2 tips which I think you'll find useful. First, don't always make the injection into the same place. If you always make an injection into, say, your arm, for instance, sooner or later, you're going to make a sore patch there. I'll show you what I mean. The dark areas on this chart show the places where you can safely make an injection. In general, wherever the skin is loose enough to be pinched up between finger and thumb. So you see, there's no need for you to make an injection in the same place more often than once a week. Now, for the syringe. The main divisions are equal to 1/4 of 1 cc. Each main division is further divided into 5. If you fill the syringe with 40 strength insulin, the small divisions are each equal to 2 units. For instance, this syringe contains 36 units. 80 strength insulin is twice as strong, so you would halve the amount. This syringe, filled with 80 strength insulin, contains the same dose as the other syringe, 36 units. Now for the injection itself. The syringe must be kept in spirit. Your hands should be thoroughly washed before making an injection, but although your hands are clean, they're not sterile, so you should not put your fingers in the spirit. Use a pair of forceps. The same applies to the needle. Handle it only by the hilt. Expel any spirit remaining in the syringe and rinse out with boiled water. The syringe is now ready for use. Clean the cap of the insulin bottle with spirit. Set the plunger to approximately the dose you intend to take and inject the air into the bottle. If you don't do this, you'll find it difficult to fill the syringe. Draw out slightly more than the required dose of insulin. Expel any air bubbles and at the same time adjust the syringe to the correct dose. Clean the place chosen for the injection with spirit. Pinch up a fold of flesh and insert the needle at a slight angle. Stop at least 1/4 of an inch from the hilt and withdraw the plunger slightly. If blood enters the syringe, make the injection in another place. Make the injection slowly. Withdraw the syringe gently and carefully. Rinse the syringe in water and return the syringe and needle to the dish. In addition to this, boil the syringe in water for 3 minutes at least once a week.
I think I can remember that. But tell me, at the moment I have to come back to the clinic in 2 weeks. Will I always have to come as often as that?
No. At the moment, you're still settling down. But once you get used to the routine, you can come less often. How often depends mainly upon yourself. If you can control your diabetes so as to keep your blood sugar at a reasonable level, you need only attend every now and then for a general checkup.
Well, that sounds all right. But how do I know what my blood sugar's doing?
Well, that's easy. You remember, we began by talking about balance. We said that if you had too much sugar for the available insulin, the balance is lost, and the sugar accumulates until some is removed by the kidneys. This sugar appears in the urine, and fortunately, there are chemicals which can detect the presence of sugar. If you come over here, I'll show you what I mean. They're made up in tablet form, and you add them to the specimen. In a few moments, there's a color change, as you see. Now, by comparing the tube with the colors shown on this chart, you can find out the percentage of sugar in the specimen. In this case, about 3/4%. If it's high, you've probably been careless about your diet. But if it's consistently more than 1%, you should report for a checkup.
So, by making this test, I can see how I'm getting on each day.
That's the idea. Then if anything appears not quite right, you can come to the clinic for advice.
I wonder, could you tell me anything about insulin? What it is and how it's made?
Well, it's not made exactly. It comes from animal pancreas, and extracting the insulin from the pancreas is quite a complicated process and is undertaken by several factories on a large scale. This company was one of the pioneers of insulin production and was the first to make insulin commercially available in 1923. The plant works day and night to supply the demand for insulin and uses many tons of pancreas each week. Most of the pancreas comes from abroad and arrives at the factory deep frozen. It is reduced to a paste and mixed with alcohol, which dissolves the insulin. Then follows a long and complex series of processes which gradually remove all the impurities. It takes 1/2 ton of pancreas to produce just this much pure insulin. Preparation of insulin for diabetics is carried out under strictly sterile conditions in a specially protected room. Finally, the bottles are thoroughly inspected for faults and imperfections before being packed. The packs are color-coded in accordance with the standards adopted by the British insulin manufacturers. Well, I think we've told you just about all there is to know about diabetes, from diet to insulin. Now, it may seem fairly easy for diabetics to make a reasonably good job of looking after themselves, and so it is, provided you stick to the rules. But when temptation is strong enough, rules are apt to be forgotten, sometimes with embarrassing consequences. For instance, Miss Smith should be having her dinner, but she likes dancing. She intends to have something to eat later on. Now, the insulin she took this morning is designed to have its maximum effect in time to counteract her evening meal. If she doesn't have the meal, her blood sugar will fall rapidly, and the balance will be lost. This is why you must have your meals at the correct time. Exercise, like dancing, tends to burn up blood sugar and will make matters worse. Symptoms may vary slightly with different people, but a headache, perspiring, or blurred vision are warning symptoms. It is just for this sort of emergency that we urge diabetics always to carry some sugar and their diabetics card with them. Sugar will counteract the effects of insulin, and if she takes several lumps in some coffee, she'll quickly recover. You were very nearly in trouble then, weren't you?
Yes, but I did remember to take the sugar. I don't think I'll make that mistake again.
No, I don't think you will either. But be very careful not to make another mistake, which is just as serious. You were in trouble on that occasion because your blood sugar was too low. But too high blood sugar can also cause trouble, and it may be more difficult to recognize in time. High blood sugar may be caused by failing to take your insulin or by an infection. Now, suppose you haven't been feeling very well. It's probably just a bad cold, but one morning it's worse. You should take your insulin, but that means getting up and getting breakfast as well. Too exhausting. So you decide to skip the injection and the breakfast. After all, you'll probably feel more like it after an extra hour in bed. But that is a serious mistake. Now, as well as the cold, your blood sugar will begin to rise. After a time, you'll begin to feel more ill and less like eating. You may feel sick and begin to breathe heavily. Sooner or later, you'll probably be very thirsty. But by this time, you'll begin to realize you really are ill and phone the doctor. The first thing he'll ask you is, have you taken your insulin? It is in just this way that a trivial illness can lead to a serious diabetic condition. Whatever happens, always take your insulin. In case of illness, you may need more insulin, but never less. And if you can't face your food, take sugar, or whatever is suggested for emergency use on your diet sheet. If ever you are in doubt on any point, go to your clinic and ask for advice. That's what it's there for. And remember, if you take the trouble to learn and apply what they teach you, you'll rarely have anything to worry about. You can lead as active a life as you wish and pursue your hobbies just like anyone else. The secret lies not in putting up with diabetes, but in learning to live with it. Once you realize this, there is no obstacle you cannot overcome. This is being proved each day in industry and commerce and everyday life.
Hi guys, I do hope that you've enjoyed the short video on living with diabetes. Just one comment, there was only really one thing that was outdated in that video, and that is sugar, sweets. Although it does mention that everything is broken down into sugar, but the dietitian spoke about staying away from sugar, meaning candies and sweets and stuff like that. Well, we know now today that anything you eat is broken down, and any carbohydrate that you eat is broken down into glucose. I know a lot of people like to say sugar, but I think it's better to say broken down into glucose, because I really think that it helps to make that distinction. I think this is one of the reasons why some people confuse sugar, as in candy, sweet, with glucose. And I think it's important to, in my opinion, to start using glucose rather than sugar, even though it is sugar. But you know, it makes that distinction between and it helps, I think it helps people not to get confused in thinking sugar means candy. Stay away from candy. No, it's glucose. The other thing is to point out that Saxon was actually a product that they used to sell. It was a sweetener, and that sweetener was saccharin back then. Now, thank goodness, we have so many more different types of sweeteners on the market, as saccharin has proved to be harmful to many people. The other important thing about this video is that it talks about sticking to the regimen, sticking to a plan. Regardless of what type of diabetes you have, it is so important to stick to your plan, and stick to what your doctor has planned out for you, and or finding out what works for you. And whatever that is, you make sure that you include carb control and exercise within that regimen. Because although the video is an old video, one thing that still stands today is the way to control your diabetes. Although there's no cure yet, it's the fact still remains that carb control and lots of exercise and body movement is the key to help controlling your blood sugars, whether you're type 1 or 2 or gestational, whether you're fat or skinny. It's very, very important. And I'm one person with the belief that it is priority to control your blood sugars first before your weight, you know. And those of us who've been diabetic for a long time know exactly what I mean by that. Okay, because you know, losing weight has always been a struggle. It's always been a struggle for me. And you know, you may, you know, if being overweight is a genetic factor like to you, like diabetes, then it may be possible that you may never lose weight, you know. But if that is the case with you, then the fact still remains that it's important to control our blood sugars, because that's what's going to help us to prevent the long-term complications. You know, I don't know if you've noticed, but I've noticed after watching this video that the dietitian did not mention type 1 or type 2. And I think that's a very important thing to keep in mind, because way back when, thousands of years, for thousands of years, there was no type 1, type 2, gestational, MODY, whatever. Diabetes was just diabetes. And, you know, diabetes has been around for a long time. A long time. You know, the media wants you to believe that it's this new thing that just came that came up because Americans are just too lazy and fat. We watch TV all the time. We don't, you know, move. But diabetes was discovered about 1500 BC. That's right, 1500 BC before Christ. They didn't have we didn't have the term diabetes back then. I think it was called sweet sugar or something like that. Something sweet. I don't remember what the actual name for it. It was discovered in Egypt. So diabetes has been around for a long time. This isn't a new thing, you know. So I'm saying this to say that, you know, I think that the capital is to just doctors. You know, it shouldn't be in the general public like that. You know, if you go and you do research or whatever and you happen to find out what it is, you know, cool. But to put that out in the media, I really think that's was a bad thing. And I'll tell you why. The reason is because it's created such a divide amongst the diabetic community and stress amongst people who are type 2 in particular. And you know, diabetes is consistently changing. You know, we're finding more and more things all the time, and you know, the medical community is slow to get this information, you know, and by the time, you know, doctors find out what a lot of us know now, diabetes has changed once again, you know. And one thing that I think as a result of these, you know, categories or what's now labels, is that now people have developed a belief system and what they think they know about you based on what type of diabetes you have, you know. And the problem with that is because diabetes is consistently changing all the time, and when people are very strong in their beliefs, unfortunately beliefs does not inspire people to go out and read and learn and hear other perspectives when you believe you know what you think you know. You know, and because you may not be diabetic, you may not find a reason to actually go and buy a book from the American Diabetes Association or buy a book from JDRF because you don't have diabetes. You don't need to do all that. Well, the problem is that when you don't read books from accredited organizations, there are a lot of things in between that you miss. You know, there are a lot of things about diabetes that a person who doesn't have diabetes will probably most likely will never really know unless they talk to another diabetic. You know, as I've always said before, diabetes is not the same for everybody. Everybody's diabetic circumstances are different. Okay, some people, and like I said, there's growing evidence that we're finding out just recently that type 2 is also not only genetic, but it's also an autoimmune condition. And so many people don't know that. Some people still think, oh my God, there are nurses that still think you can grow out of type 1 diabetes. Man, if you are a nurse and you still think you can grow out of type 1 diabetes, maybe you should stop practicing for a while and retrain yourself. And I don't mean that as a disrespect, but You know, as a diabetic, I really depend on you. I need you to have not only the latest, not only the awareness of the latest things going on with diabetes. I need you to really understand what diabetes is. And unfortunately, this is what the media has done. They made the media tries to make you think that everything is all about food, and it's not. You know, diabetes is a metabolic disease, is an emotional disease, it's a psychological disease, it's a stressful disease. You know, it's all of those things. And you know, it's one thing that really pisses me off about, you know, the situation with type 2s. You know, people are all in your face. Oh, it's all about food and this and that. Well, you know, we are going through so much stress, and what people don't seem to realize, that stress can do so much to the body. And stress, yes, it is possible that stress can cause diabetes, because when you're stressed, you have a lot of high hormones levels, which increases blood sugar. And when you're always stressed, that means that you're more than likely are always walking around with high levels of glucose, no matter what you do. You know, and some of us deal with stress differently. You know, there are some people that may exercise for their stress, which may be, you know, a good thing. Some people do alcohol, some people do drugs. Some of us are emotional eaters. And unfortunately, when you're a diabetic, that, you know, that's a conflict of interest. You know, that's not good at all. But, you know, when you constantly badger people about what you personally think that they should do based on your limited understanding of what it's like to live with diabetes, to actually live with it and not read about it necessarily, you know, you can actually put that person into a deeper depression and have them eat more, you know, and possibly more than likely gain weight and have their diabetes even worse, out of control. You got medications that can cause diabetes and stress, or medications that cause kinds of side effects that will require you to have another medication to beat the side effect of the first one. And that second medication may have a side effect, and you may have to get a third medication to combat the side effect of the last medication. So regardless of what, I'm saying this to say, no matter what diabetes you have, it's not easy. You know, to sit there and say, oh, just eat fruits and vegetables, is not true. Diabetes encompasses so many things. And I implore you, I beseech you to be more sensitive to people who are diabetic, you know, and read more and ask more questions before you make any assumptions of any diabetic. So like I said, diabetes has been around for a long time. Now, 1500 BC, there's been a lot of conflicting information, because I've read where it's been found, the first was found by an Indian doctor, another one an Ethiopian doctor, another one by a doctor from Greece. Regardless of who discovered it, you know. Oh, and you may also find interesting, I know it's disgusting, but you know, because there was no computer technology, or because medicine was not advanced, the only way they were able to figure out whether you were diabetic or not was to taste the urine So that's where the sweetness came from. They had to taste the urine to see if it had a sweetness to it. And that's how you knew you were diabetic. You know, and unfortunately, because medicine weren't what it is, you know, today, the only thing that they could prescribe was a very, very low carb diet, which, you know, there was no type 1 or type 2. You know, they didn't know anything about, you know, diet and exercise, and, you know, how glucose is affected by exercise. They didn't know none of those things, you know. And you know, it's somehow, I like I said, I just wish that it was just one type of diabetes. I think socially, I think that it would have made such a difference. It would have made it a lot better for people with type 2 and I guess type 1s to live better and live their lives better in terms of what they have to deal with the minute they walk out their door, you know. And even within the diabetic community, you know, you got some type 1s who absolutely would not associate themselves with type 2s. You know, it's like, you know, I didn't, you know, get this way because I ate myself to death. I got it because I have to take it. I have to do blah, blah, blah. Look, we all should be supporting each other. Everybody has their own challenges. Type 1s have to take insulin, you know, for the rest of their life. Type 2s have to worry about god-awful complications with whatever new drug that comes out next, you know, and side effects and all kinds of things, you know. So it's diabetes isn't easy for anybody. So let's stop the judging, start reading more, start being more sympathetic to people who have diabetes. And let us diabetics try to have more patience with people who don't have diabetes. You know, whenever someone says something that isn't true or make a judgment based on no facts about you, take that opportunity and make it an education moment. You know, because if we don't take our time to educate people, then the stupidity and the drama will always continue. So let's try to do a better job and educate ourselves, and to continue to find whatever regimens that works best for us. So I hope this video has helped you guys, and I look forward to doing my next video. Bye guys.